What's up, world, and welcome to another edition of Gold Diamond Television. As always, I want to thank you for tuning in, but don't forget to like, share, subscribe, and also click that notification button so that every time I put out a video, you'll be one of the first to know. And please always look into the description box for ways to help promote this channel and the community. Today, I want to talk about something very important that we really need to keep our eye on. Now, we know that Donald Trump, ever since he's gotten in office, has tried to destroy everything that Barack Obama has put his finger on. And one of those things is Obamacare. He's trying to get rid of Obamacare for whatever reason. And a lot of people are saying Obamacare doesn't really cover a lot. Some people say it costs just as much, not even more, as getting regular health insurance through your job. But whatever the case may be, there's one thing that Obamacare does that I didn't even know until recently, and that because of the Affordable Care Act, federal law requires that all health insurance plans cover specific preventive care services. In other words, you can go to the doctor before you get sick, before you get some kind of chronic illness, to get checked out for specific things for free. And these are the things that we as a people need to take advantage of. Because we know in the black community, a lot of us have problems with heart conditions like high blood pressure. A lot of us have diabetes that run the family. A lot of us have obesity issues. Well, the Affordable Care Act makes it a requirement that health insurers have to provide you or allow you to be able to go in and get checked out for free before you really have any problems. Which, trust me, I have a motto is I'd rather prepare than to have to repair anything. Because if you can prevent problems, then you don't have to deal with the problems down the line. Like right now, you could go, like I said, get checked out, have things done for free. But if you don't, and you do what most people do, is like try to avoid the doctor, avoid the dentist, afraid that I'm gonna go in there and they're gonna find something and I'm gonna be sick. Well, it's better for them to find something and catch it early, so that way you can take the proper procedures to hopefully be able to manage it or maybe to even cure it. But if you don't do anything, all you're doing is hurting yourself, shortening your life, and also financially it's going to cost you a lot more money and your family a lot more money, a larger burden years on down the line, which to me I feel is unfair, especially if you could have prevented that from happening in the first place. And I don't know about you, but I'd rather have do my best to try to have a long and healthy life. Live in the old age, still be healthy, still be able to go outside in the garden, take walks in the park, enjoy the grandkids, great grandkids, or whatever, instead of being in the old age and having these chronic illnesses in and out of the doctor, trying to avoid amputations, trying to avoid to take lifelong medications, all that stuff, fighting over health insurance and if I'm gonna be covered by, my Medicaid or Medicare Part B or whatever they be having them commercials. I mean, you hear the stories. I mean, I saw a story not too long ago about a couple who were married and were thinking of getting a divorce just so they could somehow be able to qualify for certain insurance because the kid has some chronic disease or illness. I can't remember exactly what it was, but I mean that's sad that you can't afford to take care of your kid or take care of an issue because it just costs too much money. But like I said, federal law requires that all health insurance plans cover specific preventive care services. This includes vaccinations, disease screenings, and some counseling. Now, this requires no copay, no co-insurance, and you don't even have to have met your deductible yet. to get these services. Now, the only stipulation is that it's free if you use a doctor or other provider in your network. Now, thanks to the Affordable Care Act, insurers must cover 6 basic services for all adults, which are alcohol misuse screening and counseling, blood pressure screening, depression screening, obesity screening and counseling, tobacco use screening and counseling, and immunization for all adults. There are also specific screenings and tests specifically for women and children. And I won't go into detail with everything that it covers, but what I will do is leave links in the description box where I get all this information from, so where you can click on it and check on it for yourselves. And people, there's nothing wrong with research. Research helps everything. Research to me is the cure for everything. If you can find out all the information you need beforehand for anything, not just healthcare, but for anything you're trying to look into, whether it be a job, buying a house, going to school, you want to get married, raise kids, there's so many things you can research and find ways and and look them up so you can learn as much as possible before you jump into something. But the thing also that I must tell you is that what it may cost you. One, an office visit, because the screen is free, but your doctors may charge you just for coming in for an office visit, which can also cost you a copay. But $10, $15, $20 copay, really not that much for a test that could normally cost you hundreds of dollars if you took these tests without insurance. Also, it could cost you if the primary reason for your appointment is something other than the preventative care that's provided. Now, I can remember going to a doctor for a specific reason, and I also, when I got there, was talking to the doctor about something else, another issue that I was having, and he told me that for the first issue, if I was coming in for the one issue, then the doctor visit would be free, like it would be covered. But if I made the other issue the primary reason why I came in, it was not going to be covered under my insurance, and I had to pay out of pocket. So he switched it up and helped me out. But like I said, but that's what that means right there. And also, if you do the screenings and a problem is found, your follow-up visits may cost you. Future follow-up visits may cost you more money. So the best thing to do with that is, once you do all the screens and you find you got issues, if you have to have follow-up visits, try to have as few of those as possible. Try to see if you can put everything into one visit or as few visits as possible, so it can cut down on costs for doctor visits. And if you have any questions about anything, always ask. Never be afraid to ask your doctor. Never be afraid to ask your human resource rep or your insurance provider what's covered under the free preventive care measurements. Because like I said, it has to be covered thanks to the Affordable Care Act. So before Donald Trump and all his people do away with this, it's imperative that you take advantage of these services, because we as a people need to take care of our health, because we have to live long lives. We got kids, like I say, grandkids. We got generations that we have to be responsible for. Because right now, at the time that a lot of our people are pushing financial literacy, so we can learn how to make money, keep money, make long-term money, look past just today, look at generations down the line. But if we're not here long enough to see our plans at least start rolling, then it'll really be all for naught. But we can discuss all that in a future video. But right now, in conclusion, get the preventative care done. Get checked out. See if anything wrong with you. Stay as healthy as possible. Always try to eat right, exercise, don't smoke, minimize the drinking, minimize your stress, and definitely take care of, take advantage of these counseling screenings and checkups, man, because there are a lot of issues out there that we feel in the black community are taboo, but just because you hide your head in the sand like an ostrich, man, don't mean it's gonna go away. It's gonna always be there. So, man, let's just take care of ourselves, take care of our people. And with that said, in conclusion, once again, thank y'all for listening. Again, like, share, subscribe. Click the notification bells. Look in the description box. Hit every link that you see in there, because it's all gonna be either beneficial for yourself or for the community. And until next time.